Now, regarding the impact that these disease has on women, first of all, it influences the decision of procreating or having children. And this is a major concern, not just for the women or their families, but for the society. In the old days, 50 years ago, there was a clear advice of not become pregnant if you had lupus. Unfortunately, there is still some physicians who advise that, and this is completely wrong. Now we know that if the disease is under control for at least 6 months, women could have children just like any other women without lupus. However, it's very important to have a very close follow-up with the specialists and the care team, including the family doctor and the obstetrician. But there is no contraindication to become a mother. However, it has to be planned because it's known that lupus, who is not under good control, and when a pregnancy comes, the disease may flare even worse, and they may end up with death for both the baby and the mother. This is why it has to be planned. And also, complications that always arise in the head of women who are becoming pregnant is my child going to have lupus? Is my child going to be born normal? And the answer for the first one is no. It's very unlikely that the baby will have lupus. However, a small percentage of women deliver what we call lupus in the baby, or neonatal lupus, which is not lupus itself, but the antibodies that the mother has, since they go through the baby, they may develop some of the symptoms that she has, like rash, but that disappears when the autoantibodies of the mother are clear from the baby. So therefore there's very minimal risk. Another important concern for women is, can I take medications while I'm pregnant? And yes, there are some medications that should be continued with while the woman is pregnant. And one of those is hydroxychloroquine or Plaquenil. And in fact, it's recommended that it's taken during pregnancy. Prednisone orally also can be taken, and it's safe. There are other ones like immunosuppressive drugs like azathioprine or Imuran that also could be taken if needed. But again, this has to be supervised with the healthcare team. And another concern once the baby is born is, can the mother breastfeed? And again, the answer is yes. And as long as she's not taking immunosuppressive drugs, and hydroxychloroquine or Plaquenil has been shown that it's safe, and prednisone is safe, especially at low dose. But again, I would recommend to plan and decide in conjunction with the healthcare team. Another concern that women have, and this is something that has to be addressed in the future and urgently, is the impact that the disease has on work.